Hi guys, welcome back to my channel. I am going to answer some questions today about remote nursing, and I hope that this will, help those who are interested to also try remote nursing and are really interested what does a utilization review nurse do, or how did it happen? Okay, so the first question that I got is, how did you start your work from home job? Okay. It really all started with a dream to work from home because my work background in the Philippines is really a corporate job. So I've been like in the utilization management industry for over 8 years. And so I really dreamt of working from home. And my mindset before was when I go to the US, after finishing my contract, I will actually not to finish the contract. My dream before was like, after I go to the US and gained some experience in bedside, I will transition to work from home. It's really in my bucket list. It's really in like, goal in life to work from home as a nurse. Okay, so that's the first thing. How did I started? I started it with a dream. And now I got that dream. Number two, I waited a year before I started to apply for work from home job, because the basic requirement for remote jobs is you have to live and to work in the United States of America. So that's the second thing I did. I gained experience first. I gained, residence first. So after exactly 1 year when I was here in the US, I saw it was really, a great timing that I saw the video of in Lefora. They talked about remote jobs and they featured Marie Peppers. So in that video, I after watching that video, I immediately enrolled in her course. So that's number three, and on the like steps on how I did on how I started my work from home. I enrolled in on an online course for remote jobs for utilization review, online course specifically. And then after that, I finished the course. I passed the exam, the certification, and then I prepared my resume. So number four, I applied to a lot of healthcare insurance companies, super like most of the companies. So just to name a few, CVS Health, BCBS or Blue Cross Blue Shield, Humana, Elevance Health, um, and Cohere, and among others. Like there's a lot of companies that I tried to apply to, and I applied for over 3 months, and then my company who hired me now is the only company who called me for an interview. So when I got that phone call and they endorsed me to a final interview, after that I got a job offer, and I immediately took advantage of it and accepted it. So there, that's the last step. I waited patiently for an interview and applied. I mean accepted the job offer. All right, so that's how I started my work from home journey. All right. Let's go now to the second question. So how does utilization review works? And what is a UR nurse? Okay, so this is where I'm going to like explain. I will try to explain on layman's term. How does this work? Like me working in the comfort of my own home, working remote. How does that work? Okay, so first things first, I wanted to like explain the workflow per se, the process. So everybody here in the US, like, I don't know if everybody, but like 90% probably of the people here in the US needs a health care insurance, because healthcare is very expensive here. So people need a healthcare insurance for them, for them to cater their medical needs, their hospitalization, or if they go to outpatient visit, if they want to consult the doctor, if they want to go to the dentist, if they want to go to their eye doctor, like anything related to health, they need their healthcare insurance. That's your BCBS, Humana, etc., etc. So that healthcare insurance will cover your medical expenses, right? So if the patient has a medical condition, so let's say a patient has heart failure, and that patient had to go to the hospital, to be confined in the hospital, to be admitted in the hospital. That's not a jargon, right? So the patient needs to be hospitalized because of heart failure. So the patient will use the healthcare card, and then that comes in, the utilization nurse comes in after using that healthcare card. Why? Because what does a utilization review nurse do? Me as the nurse will be the one who's going to check or review the medical records during your inpatient stay or during your hospitalization, if it is medically necessary. Is it necessary for you to be hospitalized? Does your symptoms is really that bad for you to be hospitalized, or you just want to go to the hospital and just stay there? So that's where the utilization review nurse comes in. That's the importance of our role. We are the ones who's going to review the medical records if the patient really needs medical attention or really needs the medical the inpatient admission. And if the patient does need it, we will provide approval for that healthcare insurance, because again, healthcare is very expensive here. So for example, on that 3-day stay in the hospital, you had like over $100,000 of total of like your payment dues, your medical fees. So as an insurance, as a utilization review nurse, I am the one who's going to gatekeep your benefit limit if it is appropriate for you to be hospitalized. So that's where it come in. And then after that, of course, if it is covered, if it is medically necessary for you to be admitted in the hospital, the insurance will be the one who's going to pay for that medical expenses. But if, for example, you went to the hospital because you are complaining of a headache, and then you stayed in the emergency room, and then after 2 or 3 hours, you actually felt better, or your headache really actually went away, but then you still wanted to stay in the hospital. You just wanted to stay in the hospital bed. So as a utilization review nurse, I am the one who's going to check your medical records if you have clinical indications for you to be admitted in the hospital, because if not, then I will have to like endorse, right? That's not a jargon word. I will have to refer your case to our medical director, and then that medical director will be the one who's going to give a decision if your admission is denied. So for example, if the nurse reviewer on my clinical judgment, you it is not medically necessary for you to stay in the hospital because your headache went away. But since that in my role, I cannot deny a case because only the medical director can deny a case. So I will be like referring you to the medical director, and then the medical director will deny the case. After denying the case, it will go to claims, right? And then if it is not covered by your healthcare insurance, then that means it will be billed to the patient. All right. So basically, that's how it works. So that's where the UR nurses comes in, and like the our importance of our role. So if the bedside nursing is like the front lines, the nurses or the remote nurses are like on the are working on the back end. But even if you're working on the back end, for me it is still a very important role because we help our patients to use their healthcare card on properly, or like appropriately or efficiently, something like that. So I think that's it. I hope that gives clarity, or like give idea to those who are interested to know how does that work, how come that the utilization review nurse can work from home or can work remotely. Because basically, guys, since we are just reviewing the medical records, we can access the medical records through the system, through computers. So that's why we don't need a face-to-face interaction with the patient. So this type of remote job is specifically for my line of business. I am working on an inpatient line of business. So we don't have 100%, we don't have a face-to-face interaction with the patients. And at the same time, because there is also somebody who asked about if we receive calls or we do outbound calls. Okay, so since we are reviewing cases, right? So sometimes, like, the medical records are not enough for me to give a decision if your condition is appropriate for admission or not. So if that's the case, I can like call the provider, because in every hospital or in every facility there is an assigned utilization management team, or UR nurses, something like that. And that is where I can call them to ask for additional clinical information, for additional medical records, for me to help me decide if that admission is really appropriate or not. So the only time that I talk to providers is when I do outbound, but we also receive inbound calls. So there are times also that the hospitals, the UR department also call us if they wanted to like request for like another review. If the case was denied, they wanted the nurses to review it again, like to reassess if it can be approved. So it happens. There's like another set of step or process for that. But what I mean is that we do get inbound calls and we also do outbound calls. But it's like, since I've worked, I only got one inbound call, and I just returned the call, but I never did like an outbound call, because most of the time we are using fax, and that's very more efficient for me because it's actually less it's not time consuming if you use fax to request clinicals or any information through fax instead of call. So that's it, guys. I think I shared a lot of information already. So if you guys are still interested to know more about remote nursing, please comment down below what are your questions and I will try my best to answer them. Thank you so much for watching this video and I hope to see you again in my next one. Bye!